If you or someone you know is experiencing tinnitus, hopefully this video can do you lots of good. If you're having chirping, buzzing, high-pitched sounds, whooshing sounds, actually any type of unusual sounds that you're hearing that no one else is, that is called tinnitus. Understand that within the cochlea, within our inner ear, you have hair cells. And these hair cells, they move along and it's connected to a nerve, the auditory nerve that goes to the brain, to the auditory cortex. And there's communication between the inner ear and the brain. And if there's any miscommunication, obviously the brain is going to interpret something different, which can be that sound that you're hearing. It could be a little more in depth than that, but generally that's what most doctors, ear, nose, and throat doctors, neurologists, or your family doctor might tell you. Maybe you have inner ear problems from loud noises. It could be from a bacteria, a virus, old age. But it's hard to buy an answer for everyone because there are many different things that can lead to tinnitus. Particularly what we call eustachian tube dysfunction. Those are the tubes behind the nasal area. They go to the middle ear. And if you've been one who's had chronic colds or sinus issues, that can be an indication that that may be causing some of your tinnitus as well. So for this video, I want to go over a little bit of some clinical nutrition, some tips, things that can help you. But there is one particular fat-soluble vitamin I want to stress on before I tell you anything. And I want to explain the relevance of what this fat-soluble vitamin that we call vitamin D can do for our hearing as well as preventing tinnitus. There are many studies out there through PubMed that indicates that a deficiency of vitamin D has been shown, has been linked to more tinnitus. Now, when you're having tinnitus, it may be something different of a sound that one is having, but it is still called tinnitus. And I want you to realize that vitamin D is known to have anti-inflammatory properties. It plays a role in maintaining nerve health. And the studies propose that vitamin D deficiency contributes to inflammation in the auditory system, affecting nerves responsible for transmitting sound signals and potentially leading to tinnitus. And vitamin D is directly linked to our circulatory system, our cardiovascular system. That means increased circulation. And so as we get older, the doctors will tell us, well, you're getting older, you have less circulation, so you're having more symptoms. And then they may recommend certain medications. We won't go there for this particular video, but that's where ginkgo biloba may be helpful in these situations because there are clinical studies that show ginkgo biloba can widen and open up the vessels to increase more blood circulation to the inner ear, the cochlea, so it can function correctly. And vitamin D is crucial for immune system function. Deficiencies of vitamin D is associated with immune system dysregulation. And researchers suggest that immune system dysfunction related to vitamin D deficiency plays a significant role in the development or exacerbation of tinnitus, which is sometimes linked to immune-related conditions. And we look back at COVID, the majority of people who had COVID had low vitamin D. That means their immune system has definitely been affected. And vitamin D has a neurological impact. The receptors are present in various parts of our brain and central nervous system. And deficiencies in vitamin D affect neurological function, including auditory processing. And changes in neural activity related to vitamin D deficiency potentially influences a perception of tinnitus. And vitamin D plays a significant role with the myelin sheath. And the myelin sheath is the covering around the nerves in the central as well as the peripheral nervous system. It's like a wire. You have rubber insulation around the wire so the conductivity can move along the wire and flow. The same thing within our nervous system. If the myelin sheath is affected, that will affect nerve impulses wherever those nerves are communicating with that will not function correctly, which can lead to pain, dysfunction, or even tinnitus. And I can tell you that if you have tinnitus, lack of sleep, stress, anxiety, loud noise, all make it worse. And if you're not getting your rest, your tinnitus is definitely going to get worse on you. In the brain, we have glutamate, and when glutamate is working at its max, that's the excitatory neurons that work through our brain when we're very anxious. And the more glutamate we have within the brain, the overexcitability of it leads to more tinnitus. And there are things that you can do that can slow glutamate down. And the simple herb chamomile, it calms you down. It has sedative properties. It contains a pigeonine, and it's been shown to interact with GABA receptors in the brain. And this promotes relaxation. Just like valerian root, extremely good. It slows down the neural impulses in the brain, those neurons, so you can relax, taking away tinnitus. And when you hear GABA, that's gamma-aminobutyric acid. That's the inhibitory neurotransmitter that plays a significant role in regulating neuronal excitability in the brain. And people have supplemented with GABA and have seen great results, as well as the amino acid taurine. Taurine works like GABA, slowing down that excitability in the brain so that tinnitus can diminish significantly. And getting some sun exposure helps the body convert into more vitamin D, which is extremely good for us. But on the other side, too much sun exposure can lead to more UVA and UVB rays, which is not good for our skin as well. But you can get your vitamin D from fatty fish such as salmon, mackerel, sardines, as well as your egg yolks, mushrooms, your fortified foods, from milk, plant-based milk alternatives, orange juice or breakfast cereals, and cod liver oil, to name a few. But one of the biggest problems about getting our vitamin D is when we supplement. Many of us are supplementing incorrectly because vitamin D is a fat-soluble vitamin. Therefore, we must be having fat in our gut, in our stomach, so we can absorb it. So if you're taking vitamin D, it may be in your multi-mineral, multivitamin, it's not going to be enough. They recommend 600 to 800 IUs, way too little. How much are you absorbing? That's the issue. So, you could be taking anywhere from 1,000 IUs to 5,000 IUs. That is something you need to discuss with your doctor. The average, I would say, is 2,000 IUs. But even if you're taking more, it doesn't mean you're going to be absorbing more. That's why you need to get your vitamin D levels checked. And because vitamin D is so important for our cardiovascular system, our brain, our lung, our immune system, our colon, our hormones, God, the list goes on and on. Our bones. You need to make sure you're getting enough vitamin D, even if you don't have tinnitus. But if you're having tinnitus, this is a win-win situation for you because you may just see miracles in your body. Hope you enjoyed the video. Please share it with your friends and family. Yes, I will attach several studies below in the description. But most important, make it a great day. I'm Dr. Alan Mandel.